There's a secret to a perfect smile, and most orthodontists never talk about that. In this video, I will reveal to you the hidden secret to a perfect smile. I'm Dr. Jeremy Manueli, board-certified orthodontist and dentofacial orthopedist, and I'm glad you're here. First, let's talk about facial profile and lip volume. Let's start with the big picture here. Before we even get to the teeth, we've got to talk about the face itself. A beautiful smile doesn't exist in isolation. It lives inside your face, and your facial profile is hugely influenced by the position of your jaws. When your upper and lower jaws are in harmony, you get a balanced profile that supports your lips and cheeks. This is what gives that youthful, balanced look. And when one jaw is too far back or both are recessed, your lips lose support and your face can look sunken or aged, and even breathing can be affected. Correcting these underlying structures is called orthopedic correction, and it involves bringing the bones forward to improve facial support. It can also improve breathing and aesthetics. And yes, this can literally make someone look younger. So orthodontics is about more than just moving teeth. It's also about making sure the jaws are in the right place. Now, if you're seriously considering improving your facial balance or correcting jaw and bite issues the right way, our team at Hamilton and Manueli Orthodontics can help. If you're in Las Vegas, head over to hmortho.com to book an in-person consultation. And if you're not local, you can head over to vegasorthodoc.com where you can securely upload your records, and we'll review everything together remotely to see what's actually possible for your face and smile. So here's where most treatments go wrong: fixing teeth without touching the jaws. Want to know how that affects your entire face? Let's dig a little deeper. Let's talk about alignment and contacts. This is the part that everyone's familiar with. Teeth should be straight, evenly spaced, and have the right contacts. Not only does this look better, but it makes brushing and flossing a lot easier, and it lowers your risk for cavities and gum disease, and also improves your confidence. But here's the thing, how we get those teeth aligned matters. Are we doing it by extracting teeth and pulling everything back? Or are we creating space by expanding the jaws and bringing everything forward to improve your smile projection? That decision alone changes the entire face and the smile. And it's why understanding alignment in context is so important. So here's a question that almost no one asks. Are we pulling teeth back, or are we building the face forward? The answer changes everything and your final look. Next, let's talk about smile width. Smile width is one of the most underrated features of a beautiful smile. Have you ever seen someone smile and their teeth are straight, but it looks like only their front 6 teeth are showing? That's a narrow smile. Now compare that to someone whose smile stretches from corner to corner, filling up that space naturally. That's what we call a broad smile, and it's usually the result of proper arch development and maxillary width. A wide smile doesn't just look great, it provides better cheek support and prevents the face from looking sunken in, and it also contributes to youthful facial aesthetics. This is one of the main reasons why I love maxillary expansion and getting the jaws right from the beginning. It's not just about making room for the teeth. It's about making room for the smile. You've seen it before. Someone with straight teeth, but a weird, narrow smile. That's not an accident. Here's what causes it and how to avoid it. Next, let's talk about smile arc. Smile arc is one of those details that once you notice it, you can't unsee it. Basically, what it means is that the bottom edge of your upper teeth should follow the natural curve of your lower lip when you smile. It's what gives that youthful, vibrant appearance to your smile. If the teeth are flat across or don't follow the lip line, the smile can look forced or even artificial. So here's a fun fact: braces and clear aligners can be adjusted to fine-tune the smile arc, but only if your orthodontist is actually paying attention to it. Unfortunately, many focus on straightening only the teeth, and this important smile enhancement goes unnoticed and uncorrected. If your teeth don't follow your lip line when you smile, you'll never get that youthful look. And unfortunately, many miss this detail completely. Next, let's talk about upper tooth position and smile show. There's an ideal display of your upper front teeth when you're smiling, and even when you're just at rest. Ideally, we want to see 100% of your front teeth when you smile, with just a millimeter or 2 of gums showing. Too much gums, and you end up with what people call a gummy smile. Too little, and you end up with a flat or aged appearance. Upper tooth position also includes the angle. The teeth shouldn't be flared forward or leaning back. The right position gives you a confident, full smile that looks natural and balanced. This isn't just something that you end up with by chance. It's the result of intentional planning and precision during your treatment. Want to learn more about these treatments and check out videos on how to correct gummy smile and how to show more of your teeth when you smile? Then you can check out one or both of these videos here. You can have perfectly straight teeth and still look off. Why? It might be your midline. Let me show you why symmetry is everything. Midline sounds simple, but it's actually a big deal. Your upper and lower midlines, meaning the line between your two front teeth, should ideally line up with the center of your face. If it's off to one side or the other, it can throw off the entire balance and your facial symmetry. Midline discrepancies can be caused by jaw asymmetries, missing teeth, dental shifting, and if not corrected, they can make the smile look off even if the teeth are technically straight. Getting those midlines dialed in makes everything else fall into place. Straight teeth that don't fit together properly, that's what we call occlusion, and if not done correctly, it's a ticking time bomb for your jaw. So let's talk about how to avoid this long-term damage. Occlusion is a fancy word for how your teeth come together when you bite. A proper bite means that your upper teeth slightly overlap the lowers, and in the back, the teeth fit together like puzzle pieces and everything is balanced and stable. Good occlusion helps prevent things like tooth wear or chipping, TMJ or jaw joint problems, chewing inefficiencies, long-term instability or relapse. This is one of those areas where braces or clear aligners can do a great job, but only if your treatment is planned properly. You might not notice it right away, but if the teeth don't match in shape or proportion, the whole smile can look awkward. Here's why those little details matter more than you may think. So let's talk tooth shape and proportion. A perfect smile isn't just about position, it's about aesthetics. The shape of each tooth matters. We're talking about height to width ratios and how light reflects off the enamel, and whether each tooth looks proportional to the others next to it. When you get this right, the teeth look natural, polished, symmetrical, and elegant. And guess what? This doesn't always mean cosmetic bonding or veneers. A skilled orthodontist can reshape the teeth slightly, align them beautifully, and create the same effect without any veneers, preps, or drilling. You can have perfect teeth, but if your gums aren't right, it throws everything off. Ideally, the gum line should be even and should follow the contour of the teeth. No excessive gums, no uneven tissues, and certainly no inflammation. Unhealthy or excessive gum tissue can hide beautiful teeth, while perfectly contoured gums make the smile look polished and complete. Sometimes this means gum reshaping or laser contouring, or maybe just improving oral hygiene during treatment, which can help shrink the gums. The goal is harmony between the teeth and the gums, not just one or the other. And finally, let's talk tooth color. A dull or uneven shade can make your smile look older even if everything else is right. So we're not talking about blinding Hollywood white here, but healthy, vibrant enamel makes all the difference. Tooth color is one of the first things people notice and one of the easiest things to improve. Once the teeth are aligned and shaped properly, whitening treatments can enhance the entire look. No one wants a dull yellowed smile even if the teeth are perfectly straight. We want brilliance, glow, and that wow factor when you smile. But with the time we have left, let's discuss something you may not have even heard about before, your airway. Because a beautiful smile is pointless if you can't breathe properly. So let's talk airway health and function. And while it's technically not a smile feature, it kind of is. A lot of aesthetic improvements we make, like expanding the upper jaw or correcting jaw position, also improve airway function. That means better sleep, better breathing, and better health overall. We now use 3D CBCT scans to evaluate airway volume and jaw size as part of our treatment planning. Because what's the point of a beautiful smile if the person behind it is struggling to breathe at night? This is where true orthodontics meets overall wellness, and it's one of the things that separates a functional, life-changing result from just another cosmetic smile. So what's the secret? The secret to a perfect smile is that it's not just about straight teeth. It's about facial balance. It's about jaw position, lip support, and airflow. It's about crafting something intentional, a smile that fits the face, supports long-term health, and actually improves the quality of life. Too often people settle for less because they don't even know what's possible. They think braces or aligners will automatically give them their dream smile. But the truth is, results vary massively depending on who's planning your case. So don't be afraid to ask questions. Don't be afraid to bring this checklist with you to your consultation. These 10 features are not just for models or celebrities, they're for anyone who wants to smile and reflect the best version of themselves. My name is Dr. Jeremy Manueli. Thanks for watching. Subscribe as always, your smile is worth doing it right, and I'll see you in the next one.